Hello, everyone. My name is Joe Hansen. I want to be the first to welcome you to the Texas Science Festival's virtual session for today. It's called Sciencing Your Way to a Healthier, Wealthier You. I'm a science writer, a biologist, educator, YouTube creator, and I'm the host of Be Smart, an award-winning science education show from PBS. And I'm really excited to be your moderator for today's session. In just a minute, we're going to welcome our brilliant, talented panelists from the UT science community. But a little bit of housekeeping before we begin. Today's session is part of the festival's Science Sparks series. Each of our experts is going to have 8 minutes to share an idea from their research with all of you. And our theme today is all about advances in science and math that you can apply in your life, because what is science for if not to make all of our lives better, right? And before I introduce our speakers, a few friendly reminders for our time together. Please remain muted throughout the entire session. We're going to hear from 3 speakers this afternoon, and there will be plenty of time for your questions at the end. The chat is disabled today in Zoom, so if you think of a great question, you can submit that at any time using the Q&A function, which you'll find there in the Zoom menu. Again, you can put those in any time that they come to you. Please do include which speaker your question is for. That will help us organize those at the end. When all 3 talks are done, we will turn to those questions and find out even more. And if you'd like to share this later or rewatch it, today's session is being recorded and will be shared on the College of Natural Sciences YouTube channel. All right, well, without further ado, I want to introduce our speakers today. Our first speaker is Marissa Burgermaster. She is the Assistant Professor of Nutritional Sciences and Population Health. She uses data science, human-computer interaction methods to improve nutrition and community health. She and her collaborators created Nutri, which is an artificial intelligence system to aid doctors in discussing nutrition with their patients, which is something I think trying to decode a very mysterious world that doctors and patients have a lot of issues connecting on. Without further ado, we'll turn it over to Marissa and find out more about her work.
Thanks so much, Jill. And I'll go ahead and share my slides. Let me know if you can't see them. All right. So thanks for the kind introduction. And I'm going to be talking about Nutri, as Joe suggested. Quickly, I have funding from the Agency for Healthcare Research and Quality, and I receive royalties from UpToDate. As most people in the audience probably are well aware, we are in the midst of an epidemic of chronic disease. And this is just the example of diabetes and the increase in diabetes prevalence among American adults in over the past 2 decades. It's a stark problem, but what we know is that diet and weight loss can have a big impact on this problem, and healthy eating is really hard. There's a lot of aspects of our food environment that are out there that don't really make it so easy to go along with what we maybe know is healthy eating. What we also know is that patients whose doctors talk to them about nutrition are more likely to change their diet and lose weight. However, most doctors only receive 4 hours, sometimes even fewer, of nutrition education in medical school. So this lack of training in diet and nutrition counseling leads to lower confidence among most physicians in talking with patients about nutrition. We need a lot of sciences to fix this problem. So I'm going to take you through just a little bit about the science that we've been using to create Nutri, which is an artificial intelligence system that it provides a tool for patients and providers to set goals together in a primary care appointment. Uses data collected from patients prior to the appointment. It synthesizes these data using evidence-based computational rules. It presents a prioritized list to guide the patient and the provider through a shared decision-making conversation, and it helps the provider and patient come together to set a goal to help the patient achieve a healthier diet. I'm going to give you one snippet of each of the 4 sciences I alluded to that went into the design and implementation of Nutri. So the first is behavioral science. In the world of behavioral science, we know that behavioral intention, setting a goal, having the intention of achieving a behavior, along with self-efficacy, the confidence that you can actually go ahead and enact a specific behavior, are what leads to behavior change. And one specific strategy that has been identified as effective, and importantly, in the context of a primary care appointment brief for helping people improve their behavioral intention and self-efficacy, is a strategy called collaborative goal setting. For the nutritional sciences snippet, I'm going to sneak 2 snippets into here. The dietary guidelines for Americans, which are represented here by an image that you perhaps have seen publicly before. It's part of the messaging from the USDA. The dietary guidelines are the best synthesis of nutrition evidence that is synthesized every 5 years and presents the whole of what nutrition scientists know to be true about what we should and should not be eating. So that's an excellent way to guide your nutritional choices. The second half of this slide is ASA 24, which is the gold standard of collecting data about nutrition from patients, self-reported nutrition from patients. The data science aspect of Nutri, this is the AI, is an expert system. And what we do is take the data from ASA 24, combine it with expert knowledge that is gleaned from the USDA dietary guidelines, and present it through our user interface to the primary care providers and patients in an appointment. And the computer science aspect of Nutri is a specific area of computer science called human-computer interaction. So we went through a series of experiments and qualitative studies in order to develop a user interface that actually helped providers to conduct this behavioral science-focused conversation with nutrition evidence with their patient. So there's our 4 sciences within Nutri to collect accurate data, to automate the analysis and synthesis of these data, and to provide knowledge and facilitate skill building at the physician's fingertips during an appointment. But what we need to know is if it improves counseling, in fact. And so, along with our partners at Lone Star Circle of Care here in Central Texas, we conducted a randomized control trial completed in December of 2022. So we've got some hot off the presses results to share. The first is that primary care providers use Nutri to set a goal with their patient 100% of times it was presented during an appointment. Second is that providers randomized to the Nutri intervention group experienced significant improvements in counseling competence compared to the control group. And I will let you read yourself a quote from one of our physician participants, but it was really gratifying to see that one of our physicians not only captured the essence of why we developed Nutri, but also really hit on that idea of shared decision-making and this interactive tool as something that could support exactly what providers are trying to do in their appointment. And then, since we're a panel about health and wealth, I thought I maybe thought I should share a little bit about wealth, but I just love this quote from one of our patients. Above all is my health. There's my life and my health that is worth more than everything. So with that, I'd like to acknowledge and thank my lab, my collaborators, my funders, and welcome questions. I'm looking forward to the panel discussion. Thanks, everyone.
Thank you so much, Marissa. That's super interesting. I want to remind everybody you can get those questions into Q&A at any time. We'll be watching that. If our parents did a pretty good job at telling us what to eat, we'll see if AI can do a better job. We'll keep this moving and move on to our second panelist today. It's my pleasure to introduce Thalia Zarafopoulou. She is a professor both in mathematics and in the McCombs School of Business at the Institute of Risk. There's a funny acronym I had to look up here. The Department of Information, Risk and Operations Management. She holds the Presidential Chair in Mathematics and the Neuhaus Professorship in Finance here at UT Austin. She was the first holder of the Oxford Mann Chair in Quantitative Finance at the University of Oxford. And her area of expertise is in financial mathematics and stochastic optimization, which sounds very cool. And I guess we'll all wonder if this is full of tips to make us all wealthy and perhaps wise. All right, turn it over to you.
Thank you so much for the introduction. I'm very happy to be here. Let me share the screen and can you see my slides? All right. So I will start with, this is a folk saying that we have in mathematical finance. As we know, all of us know, mathematics is the mother of all sciences, and finance is their mother-in-law. So today I will be talking about a very new area in quantitative finance, which is Robo-Advising. And I don't know how familiar you are with Robo-Advisors. This is a very exciting, a very new, if you like, AI area in quantitative finance. It is right now very popular among the young generation. So Robo-Advisors were launched in the wake of the 2008 financial crisis. They have many advantages for taxes. They are fully automated. They are extremely affordable. And slowly, actually not even slowly, very, very fast by now, they are becoming both day-to-day and long-term money managers, especially for the young investors. If you look at the funds that are managed under Robo-Advisors these days, you can see how fast they grow. From the research point of view, this is an area in its infancy. And as you are going to see, there are very exciting mathematics, but there are also very fundamental problems that we do face in practice in Robo-Advising. So what I will do, I will present you the, if you like, a human-machine interaction system and take you through the different parts of the system and discuss where mathematics enters and where the challenges are. So when we talk abstractly about a robo-advising system, essentially we have two actors, the client and the robo-advisor. The robo-advisor is an automated wealth manager. So what happens here from left to right, the client is affected by life. And when I say life, I mean health, ambitions, work, family situations. There's a long list of factors here. And also the client lives in some way, directly or indirectly, in a market environment. So if we are academics, we have our retirement funds. We are also investing in markets and so on. So these two universes affect the client. The client formulates wishes, goals, needs, communicates them to the robo-advisor. The robo-advisor has direct access to financial markets. The machine gets information from the client, comes up with a plan, which we call the asset choice, and then communicates it back to the client and so on. So when we talk about a robo-advising platform, this is abstractly what we mean. However, as you are going to see in all parts of this very simple scheme here, there are many difficulties. So let's try to see what we as mathematicians have to think about. So first of all, the very first challenge is how to model the client. When we talk about the client, we talk about a human that demonstrates all kinds of human behavior. So we talk about risk tolerance, risk aversion, impatience, greed, fear, hopeless feelings, panic when the market goes down and so on. We have very few models, if any, that capture the stochasticity of the human behavior towards markets. For this, we need to build models in what we call stochastic processes, behavioral finance, and also there is an area in mathematics that is used primarily in material sciences and weather prediction and so on that has to do with multi-scale analysis. Why? Because the time scale in which I change my feelings, the time scale in which the market moves, time scale that the robo communicates with me are very different. So these are very exciting areas in stochastics and more generally in what we call mathematical analysis. The second area in the human-machine interaction system has to do with communication. So how often does the client communicates with the robo, and what kind of questions should the robo ask the client? Currently, what we have is very naive and does not capture any complexity we want to put in the system. From the mathematical point of view, this relates to an area that we call optimal stopping problems, random times, and they relate to when the question should be posed, what kind of question should I communicate to the client, and so on. So this is part number 2. The third part has to do with how the machine decodes the client. This area lives, I would say, in dark ages. Somehow, and we don't know yet how, the robo has to decode the client. So from the information, the verbal information the robo receives from the client, the robo has to come up with a stochastic quantitative model. A main component of this model, of this part of this interface, is what we call inverse problem. So from the information the robo gets from the client, the robo has to extract what we call the feelings, the risk preferences, the risk aversion of the client. This is extremely difficult because we're talking about a stochastic environment, an environment that moves with time randomly, and also we talk about goals that are posed for the future. And we don't have a good quantitative theory to build decoded structures. The next part is once the robo gets information from the client, the robo has to use the market. This is, after all, one of the advantages that the robo has, direct access to the market. However, how to use this information from the market, how to manage what we call market risk, which is misassessing the market opportunities for the future in the short and the long term. this is one of the big challenges we have today. This is a huge area in quantitative finance, in statistics, and it all relates to what we call stochastic modeling for the financial markets. So once the robo gets information from the client, decodes the information from the client, harvests information from the markets, the robo comes up with the asset allocation. This is one of the hardest stochastic optimization problem. Why? Because it is high dimensional, it is highly stochastic, and also because we deal with humans, humans are not rational. So we have many financial goals that are not what we call, from the mathematical point of view, time consistent. So if you look, for example, at intergenerational financial management, what the parents do and what the children do is day and night. There is no good mathematical theory to optimally solve the underlying problems. We are highly inconsistent creatures. So therefore, the robo has to take this into account, and in some ways, many times actually go against our wishes, because the machine knows that in the long term, we will be very content with it. An example, the robo, because of statistical information, many data analysis and so on, knows that certain groups of clients will overreact to downshifts of markets. So what will the machine do? Will the machine go along with the panic, or should the machine play somehow an advisory role against the panic? So these are wonderful mathematical problems. The bad thing is that they are mostly open. And the last part is we need to come up, we don't know yet, we need to come up with what we call performance risk metrics. And once we do that, then we should be able to evaluate the robo's performance. This is extremely difficult, and we are building algorithms, but what we face here, one of the difficulties, is that individuals are what we call algorithm averse. So once the robot does not perform well, then we switch to a different, either robo or the traditional advisor. So the whole thing becomes what we call a game, a stochastic differential game, because we live in a stochastic dynamic environment. And therefore, the question is, how do all these parties interact optimally? This is a big and extremely interesting area, even though it is mostly static for now. How do you allocate risks? How do you allocate the flow of information so that the robot can perform as well as it can for the client's wealth? So this is what I would like to say. Thank you for listening.
Thank you so much, Dalia. We're going to move right along to our third speaker today. I want to introduce Roger Peng. He's a professor of statistics and data sciences here at UT Austin. He's also the co-host of a podcast called Not So Standard Deviations, all about data science. He's the author of R Programming for Data Science and 10 other books, all about data science and statistics. He was previously on the faculty at Johns Hopkins, the Bloomberg School of Public Health, but UT got him. And his work centers on developing theory to build successful ways to analyze data and build methods for addressing public health concerns. Roger, turn it over to you.
Okay, thanks a lot for that great introduction. So I just want to talk a little bit about some work I've done in the area of environmental health, in particular looking at outdoor air pollution. So I've worked a lot on outdoor air pollution studies throughout my career. And I think one of the things that has made them interesting is the kind of advancement of data science and statistical techniques in the kind of ability to do them. So most air pollution kind of studies have their roots in kind of significant air pollution events in the past. So this is the London fog in 1952. And also many events here in the United States, like in Denora, Pennsylvania. And these high extreme events inspired people to look at the data and see what was the impact on human health. And in probably one of the most straightforward and perhaps kind of earliest air pollution studies was of the London fog, and this is a 2-week period in December 1952. And in the solid black line, you can see the level of kind of what's called black smoke, or what we might call total particles right now. Goes up significantly over a couple-day period, and then you can similarly see the number of deaths kind of goes up, shifted to the right a little bit, and then slowly comes back down. And so this is what you might call a time series study these days. And some estimates of the excess deaths in this time period were on the order of 10,000 deaths. So for the most part, we don't live in a world like this anymore. Air pollution levels have gone down quite a lot since then, unless you live in areas like Beijing or in India, where air pollution levels are not quite so high as they were in the London fog, but are still are very high. And if you look across the world today, this comes from the WHO. The situation in the United States is quite reasonable in terms of levels of this is for particulate matter air pollution or airborne dust. But in many other parts of the world, even in parts of Europe, Middle East, Asia, and South America, and Africa, the levels of pollution are quite high beyond any sort of US or even WHO standard. And so there is still kind of an uneven distribution across the world of air pollution kind of concentrations. So one of the things that the WHO has done recently is kind of keep track of the leading causes of death all over the world. And if you look at the top 5, one of the things that we can see is that air pollution is actually linked to all of them. It's outdoor air pollution, that is. And the WHO did its own calculation that looks at kind of what are the attributable deaths to ambient air pollution. In this case, for this particular report, they calculated about 3.7 million deaths worldwide that are kind of attributable to outdoor air pollution. So it is a pretty big problem, even in modern times. In the United States, we've seen a massive decrease in air pollution concentrations across, this is just for the last 30 or so years, 20 or so years. And this is for fine particulate matter, also called PM 2.5. And you can see there's been about a 40% decrease in annual average levels across the country. And so each of these gray lines here is a county where we have an air pollution monitor. So I've plotted all of the air pollution monitors in the country. And you can see that things are generally going down, and the levels here are quite low. They're below 10 micrograms per meter cube on average. But there's still evidence of a continuing risk at low levels of air pollution. So there hasn't really been identified a safe level of air pollution. And even at today's level, for example, this is a study that we did looking at asthma hospitalizations, which is a pretty serious situation, and fine particulate matter in the United States. And we found that counties that have about a 10 microgram per meter cube increase difference in fine particulate matter was associated with a 7% increase in asthma hospitalizations. So even at the low levels that we experience today in the United States, there is still evidence of kind of increased risk from levels of fine particulate matter in this case. So I just want to get what is the basic gist of an air pollution study. It's on the surface, it's relatively simple. We take cities, for example, like this clean picture of Chicago on the left, and we take cities like this somewhat less clean picture of Los Angeles on the right, and we compare the two cities and their air pollution levels. And we also look at things like their health statistics, for example, mortality or hospitalizations or doctor's visits or things like that. While that sounds relatively straightforward in the way I said it, what's actually required is a very complicated process, and we have to collect a ton of data to do this. And so we collect data from the US Census. We have data from the EPA, of course, so using their air quality system, their monitoring system across the country. There are also state and local monitoring systems that merge with EPA. We got satellite data from NASA, from their Terra platform. and as well as kind of computer model data from both from NASA and EPA. They model air pollution concentrations using this CMAQ model. And then we have emissions inventories. And then on the health side, we also, one of the strategies we've taken is to look at insurance claims. And so we look at Medicaid and Medicare because these are national level programs, national level insurance programs, and we can look at claims for various diseases and see whether they are associated with changing air pollution concentrations across the country. And so now, as complicated as this is, this strategy that we've taken here allows us to look at the entire country all at once and to do a kind of a national level study looking at air pollution and health. And so once we've got all this data together, it has to be assembled, it has to be cleaned, it has to be processed, it has to be linked together. And then we do a significant amount of computation, the details of which I won't go into for now. I'm always happy to do that, but not for the moment. And one of the things that we basically do, so if on the left-hand side, for example, we can build a prediction model that can predict what the ambient or outdoor concentrations of air pollution will be all across the country. So on the left, here's a map that we've made of, this is fine particulate matter, where we can predict what the levels will be at all across the country, even if there's no monitor there, because we can kind of use the data where there are monitors to kind of train a model. And then we basically want to relate that map to another map of, in this case, asthma hospitalizations, but it could be any other health outcome. I want to see, is the map on the left associated with the map on the right? And so that's the basic gist of how our national level air pollution studies are working. And so this is just one example. This comes from a study looking at fine particulate matter and hospital admissions in Medicare. So these are older people. And we found that for like a 10 microgram per meter cubed reduction in particulate matter, we could that would be associated with an annual reduction of about 11,000 hospitalizations just in this population alone. So that's all I wanted to say today. So that just to summarize, I think there have been massive improvements in outdoor air quality in the last 50 years, but there still continues to be evidence of health risks, even at these kind of today's lower concentrations. So the changes and kind of improvements in data science and computational techniques have allowed us to do really large national level studies to kind of produce comprehensive evidence on this topic. And I think moving forward, we want to look at kind of what are the more harmful sources of air pollution, how can we target them to reduce or to improve health and kind of improve the outdoor environment. So thank you.
All right, thank you to all of our panelists. This is a fantastic group to have together because we all have to eat. We all have to worry about managing our money, and we all have to breathe. So these are universal concerns. Thank you to everybody who has submitted questions in the Q&A. We're going to keep that open and keep our eye on that as we can go through here at the end. And I'm going to pass a few on to our panelists here. Just a reminder, to our panelists, we can try to keep the answers concise, get through as many as possible. People are very interested in nutrition. I think it's something that's on a lot of people's minds. Marissa, a question came through on where several questions came through on where Nutri or apps like it are available, but one in particular is it possible for anyone to use this, and in particular without going to a primary care physician, because that's not always something that people have equal access to, and particularly among the groups who might be at the highest risk for some of the nutritional choices.
That's a great question. And so many people are aware there's a lot of nutrition apps out there. And the tricky thing about nutrition apps is, are they based on good evidence? Do they have a data structure backing them up that actually gives accurate information, right? So it's really tricky. And there have been studies that demonstrate that most commercially available nutrition apps aren't particularly reliable. So there are some examples that have come out of well-researched principles, but the thing that makes Nutri different is that it's specifically to guide that patient-provider interaction. So we have a hypothesis that the communication between the patient and provider is what promotes motivation among patients in order to help them achieve their dietary behavior change goal. But that said, we are planning a study to actually test that out. So we're developing a version of Nutri that doesn't need a provider so that we can see if the piece with the provider connected to it does actually have a effect over and above the effect of just having the personalized data science aspect of it to interpret yourself.
A question for Thalia. I think everybody wants to know, do you manage your money with a robo-advisor? More seriously, a question came in from Archie. The idea of where fiduciary responsibility fits in, and this is something that financial advisors are trained and have sort of ethical guidelines organized around, and where does that feed into the inputs and programming that goes into a robo-advisor?
Yeah, this is a great question, but we are not there yet. Robo-advising is very recent, so there is a lot of work to be done before we reach this point.
And you can answer or not whether you yourself use a robo-advisor, but
oh, I thought this was no, I don't, because first of all, I'm not young, and secondly, I know the risks, but I think I will be using it in the future. And also, robo-advising is not only for wealth management. There is a sub area in robo-advising that advises about debt consolidation, other aspects of bespoke personalized finance. And I should also say that because I'm very much interested in quantitative medicine, that the same way you have a robo-advisor to give you advice about your wealth management, and it is personalized, highly personalized, we do expect that at some point we will have the robo-medi advisors, not for extremely important aspects of our health, but a considerable part of medical needs could be managed through some automated advisors. Yeah, but we have a while to go.
A question for Roger. Are you concerned, this came from Jane, are you concerned that your data, the statistical conclusions that you take from looking at the relationship of pollution to health, may provide opportunities or advance causes of not continuing air pollution controls in certain places?
Yeah, that's a great question. And it's not a simple one, I guess is what I would say. So I think it's difficult to kind of say how any research, in general will be used by people who are either developing policies or creating programs, into this case, for example, for pollution control. I think one of the things that I feel is most important is that we have to create the best evidence that we can and to kind of conduct the best studies that we can to figure out what is going on across the country, in this country and maybe others, with respect to air pollution and various health outcomes and in different populations. And so in the United States, there is a mandate in the law to protect people with a margin of safety. So, and I think the evidence so far suggests that there is still an association with air pollution, between air pollution and health at reasonably low levels. And so there is a reasonable amount of work to be done. And I think one of the things that can be focused on is what is the strategy for kind of targeting the most harmful sources to identify, what can we efficiently reduce air pollution concentrations, so we can kind of have the biggest impact on health. But I think the developing policies for air pollution control is a complicated thing. It's not just about science. There are other things to kind of develop, and that's why policymakers have a hard job.
Another question from Marissa, from Hector. The idea of nutritional advice is a large category. Wondering if there's some specific examples of questions or recommendations that Nutri was able to answer or help doctors recommend to their patients.
Sure. So Nutri is built on the 9 recommendations from the dietary guidelines for Americans. So basically all of the nutrition evidence out there boiled down to 9 goal phrasings. And we use the patient data in order to prioritize which of those goals might have the biggest impact on that patient's health, according to the dietary guidelines for Americans, and how close or far they are from that goal. So it really, it sort of just contextualizes the possible nutrition advice that could be given from the provider to the patient from that evidence base of the dietary guidelines for Americans. And what's important about Nutri is that we keep that autonomy of the patient and provider, so they choose together what is going to be potentially most impactful for the patient that the patient can actually achieve. So that's, I think that's I'm trying to be concise, Joe. You can actually follow up if need be.
That's perfect. Dalia, we've had a few questions come in about whether or not Robo-Advising is ready, and I don't want you to be in the position of giving financial advice, but if a question came in from Pratik, if I'm pronouncing your name correctly, if Robo-Advising is not yet ready, is the best advice to still invest in, the example given here is low cost index funds and don't touch them, but perhaps to interpret that as low risk and long time and some of these sort of general, like very old and eternal rules of investing? Or do you expect there to be sort of unique advice that comes from the insights that Robo-Advising can give?
I don't think the Robo-Advisors will give much different like recommendations. What works to their advantage is that they are extremely affordable. They can be used by a very big part of the population, and I strongly believe that they will increase the financial literacy of the individuals. Whether they are going to advise to invest here or there, I cannot comment, but overall, they will contribute to a better financial education and behavior of people.
Roger, a question came through about indoor versus outdoor air pollution from Kristen Patterson. Of course, indoor air pollution has been increasingly in the news in the past few years. Sort of how local can you get with your ability to draw conclusions? Can you get local enough that the same kind of workflows can be used to draw conclusions about health in indoor environments as well?
Yeah, so great question. And another big part of what I work on actually is in the indoor environment. There's only so much I can present in 8 minutes, but I think I think the strategies that we use to study that, which is also important, and are kind of very different, because we're looking at very small scale, as Joe said, very small scale, localized kind of differences, and also the indoor environment is something, for example, in someone's house or in your living area, is something that we have some direct control over, as opposed to, say, the outdoor environment. We can't really expect individual people to kind of be lowering the air pollution levels in the air. So that's more of a kind of a different strategy that we have to take to kind of address that problem. So I think, but the differences in the indoor environment are also very important. There are also other things in the indoor environment, besides pollutants. We have things like allergens and other biological factors that we think about in those kinds of things. So that kind of mixture is important to study, and we've done quite a bit of work in there too.
So one is perhaps not better than the other, but they're very different.
No, and I think if you look in the same WHO report about the kind of burden of disease across the world, the indoor and the outdoor environment are kind of about the same, I think.
We did have a question that came in, give all three of you the opportunity to answer. And if you'd like to do it in the order you presented, I think that would be easiest. But Vicky asks, in a minute or less, and you can certainly be faster than that. Is there, because this is sort of an advice session, how to get healthier and wealthier. In a minute or less, how can the insights that you shared, or an insight that you have come across in your work, help guide people's daily choices? These are tools, sort of for the future, for the large scale. Is there something that's come out of your work that perhaps you use in your own daily choices?
I'm going to twist the question a little bit on its head, but the thing that stands out to me, and I think it kind of resonated while Thalia was talking about the Robo Advisor as well, is, there's all these technology tools out there, AI, data science. We're using all these data in order to help guide our choices. And there's this sort of panic of, oh, is the AI coming for everybody's jobs? Are we still going to have experts in the medical field and maybe in the financial field also? I'm not sure. Talia would have to speak to that. But I think that the importance of what a tool like Nutri is doing is that it's actually making it more possible for doctors to do their job and the thing that they're trained at, which is to diagnose and treat and prevent diseases and talk to their patients about it. Using the AI takes the having to collect data, which is something that humans aren't very good at, and synthesize that data into something actionable. Again, humans we're very prone to cognitive bias. So having a tool that can automatically do that for you is very helpful, but then leaving the conversation to the patient and provider to have. Computers aren't very good at that. Oh my goodness, the Bing chatbot, yikes. You guys saw what happened in the news last week. And so this is a great way to show how those two strengths can make something better. The whole is greater than the sum of the parts.
Dalia and Roger, if either of you would like to share an insight from your work that perhaps you apply in your own daily life.
Yeah, so to agree with with Marissa, automation and in my word, quantification, these are two different things. But when you quantify things, this is very helpful to make progress. And I think this is extremely important. So RoboAdvisor is not just for my own finances. It could be how to manage better to be defined, let's say, universities' endowments. And will we get rid of the traditional advisor? No, the same way that you will not get rid of the medical doctor. But on the other hand, I think, and I plan to apply it in my own life, a combination of robo and traditional advisor will dominate in the very near future. That's what I think.
Maybe I'll just say really quickly, just to similar to what Marissa said, there's a lot of new technology out there now that really kind of makes it possible to take measurements about our environment and to kind of see what's going on in our local areas. And so while I think the individual person can't just single-handedly change government policy, we can measure our environment, see what's going on, and see what things are. And there are all these little air pollution sensors that we can buy that are actually relatively inexpensive, and they can give you a lot of information about what's going on kind of in your area. And so I think that's an interesting way to get involved and also kind of to contribute to science too.
Well, thank you, everyone. Those were great answers to some wonderful questions from our community and our audience. We have reached our time. I want to extend a huge thanks to our three speakers today, also the organizers, and to thank all of you for being here with us.